Hi, I'm François Houÿez from EURORDIS to explain you the outcome of the HTX project, Next Generation HTA, and in particular today, I would like to explain you regarding the patient-reported outcome measure, different tools that can be used by you directly, where you self-report the information, for example, to a device, can be a smartphone or a desktop. And for the example of today, we will continue with the EQ5D in the second video on this tool, the PROM Select App developed by HTX. So again, if you go to the PROM Select App, then you have the possibility to select different types of tools for different diseases, different problems. So let's go to the generic tools to measure quality of life and the European quality of life, the EQ5D, which is one of the most frequently used, developed by Eurocall. And let's go to the demos. And for the demos, you have access to different types of tools you can use. The ones we looked at yesterday need to be filled in by a healthcare professional. They ask you the question and you report. You explain how you feel today. There are other ways where you can respond to yourself directly, filling in the form yourself, and the form can be digital. So this is the form as used by the healthcare professional. The EQ5D for 5 dimensions: mobility, self-care, usual activities, pain, discomfort, and anxiety, depression. And for each domain, for each dimension, there are 5 possible responses, 5 lines where you can report to the healthcare professional how you feel. But you can also choose and have a look at the self-complete version to be used on a digital device. And if you select this one, you have the 3 levels, the 5 levels, or the youth version. So let's look at the 5 level for adults mostly. And so this is how it looks like on the device. And the first question, if you have moderate problems in walking about, then you tick the 3rd level, the 3rd line, and then you move yourself to the next question. You're not responding to someone, you're filling in the information yourself. For self-care, washing or dressing myself, let's say no problem. For usual activities, let's say slight problems. For pain, discomfort, let's say today you have severe pain or discomfort. And then anxiety, depression, let's say that's moderately anxious or depressed today. And with this, you completed the 5 dimensions, and the final step is on a scale from 0 to 100, which represents the best health you can imagine for you. Where would you rate your own health status today? So let's say, for example, 68, and it shows there directly. And then you press next, and you have completed the questionnaire. So this is the version for 5 levels. There is also this version with 3 levels, 3 possible responses for each dimension, easier for young children, younger people to respond to. Sometimes it's difficult to feel a difference between slight problems or moderate problems. So the questions, the responses are no, some, or a lot. For each dimension, you will have these 3 possible responses. So again, then it works the same. You select the dimension and then the response, you go to the next, and at the end, you inform on your level of health status as you feel today. And with this, you complete yourself the questionnaire. So just to say that there are two aspects to patient-reported outcome measures. First thing, you report yourself how you feel, and you may be reporting to someone, a healthcare professional, or you may be reporting yourself directly to the system. In that case, it's a self-completed reported outcome measures that is usually proposed using a medical kind of device, but it can also be a paper form that you fill in, and then you will submit it to someone who will enter the data in the database. All right, thank you for your attention.